Okay, so I presented the topic of dose reduction before attempting TFR, including presenting our own data. And this is actually a topic which is gaining increasing importance and also interest among community, as we know that both TKI dose reduction and discontinuation aim to address the challenges of long-term TKI therapy. I mean, the intolerance, toxicity, decreasing adherence, increasing financial burden, and etc. But we also know that abrupt treatment discontinuation is not, or is far from being perfect, because the TFR success rates is only of about 50% after abrupt TKI discontinuation, that there are some adverse events which we didn't expect at the beginning, called TKI withdrawal syndrome, and that also psychological aspects or issues are not very nice regarding the patient's perceptions, feelings, etc. So our idea was to design trial which is different, with gradual stepwise dose reduction, during my talk at the conference, I put this topic into the broader context of data which we already have, and we know from the UK pivotal Destiny trial, and also from some real-world studies coming from Hammersmith Hospital in UK, and also from the Italian real-world campus study, that after such a dose de-escalation, like preparation or bridge or something like this, the TFR rates appear higher than what I mentioned, of about 70%, and that also there are that some adverse events definitely go down. So I presented the overview. What is quite interesting is that this approach was also addressed in the interview or survey published by Chinese group, and they showed that patient preferred such a gradual approach in comparison to abrupt treatment discontinuation, I mean, from the full dose. And there are also quite interesting data on mathematical modeling coming from Dresden, from colleagues led by Professor Redder, showing us that particularly stepwise dose reduction was associated, or the model for it was associated with the lowest probability of molecular recurrence. So there are data supporting this approach. So yeah. It was great to present and to discuss also with community.